Hey everyone, welcome back to another High Yield Explainer. I am absolutely thrilled you're here because today we are conquering a massive section of your medical coding exam prep. Before we jump right into the material, make sure to like, share, and subscribe to Decode Healthcare with Harshal.
Today, we're literally breaking down 5 super dense sections, ICD-10-CM chapters 16 through 20, into a rapid-fire, high-yield roadmap. We're covering everything from newborns to trauma, and trust me, these chapters are packed with specific guidelines that the AAPC absolutely loves to test. Our goal in this session? Giving you the exact, no-nonsense rules you need to crush the CPC exam with confidence. Here's our roadmap for today. We're hitting perinatal and congenital rules, symptoms versus confirmed diagnoses, injuries and the 7th character, burns and drug rules, external causes, and then wrapping up with a quick summary. Let's dive in. Section 1, Perinatal and Congenital Rules. So chapters 16 and 17, I like to call these the rule breakers of the manual, mainly because they operate on some pretty absolute boundaries. Chapter 16 codes, these cover conditions originating in the perinatal period. They belong strictly on the newborn's record. You must never, and I mean never, report a Chapter 16 code on the mother's record. The exam is absolutely going to try to trick you by mixing these up in clinical scenarios, so, keep this separation ironclad in your brain. Okay, so what exactly does perinatal mean? Well, by definition, the perinatal period spans from birth right through 28 days post-birth. That's your window. Plus, when you're coding that initial newborn record, category Z38, which identifies liveborn infants based on place of birth and delivery type, that is always going to be your principal diagnosis. Lock that rule in. Now, let's flip over to Chapter 17 and see how this builds into congenital malformations. Unlike those perinatal codes, which have that strict 28-day window we just talked about, congenital codes report conditions that are present from birth, but, and here's the kicker, they can be used throughout a patient's entire life. As long as the congenital condition persists or even just impacts the patient's care, you can and should report it, whether that patient is 2 days old or, frankly, 82 years old. Section 2. Symptoms versus confirmed diagnoses. Coding this chapter is kind of like playing clinical detective. The golden rule here is figuring out what is inherent to a disease and what isn't. So if a symptom is an integral, totally expected part of a confirmed definitive diagnosis, you never code it separately. Take chest pain with a confirmed acute myocardial infarction, for example. You do not code the chest pain. It's totally expected, right? But if the symptoms are not integral to a confirmed diagnosis, or they show up without an established definitive diagnosis, well, those absolutely must be coded. Section 3, Injuries and 7th Characters. We've officially reached the climax of this explainer. Chapter 19 is a heavy hitter on the CPC exam, and it's mostly because of the infamous 7th character rule. Here's the deal. If a code category requires a 7th character, that code must have exactly 7 characters, literally no exceptions. If your base code is only 4 characters long, say something like S00.5, you actually have to use the placeholder X in the 5th and 6th spots just to push your extension all the way out into that required 7th position. Let's rapid fire through those extensions. A stands for initial encounter, meaning the patient is getting active treatment for the condition. Then you've got D for subsequent encounter, which covers the routine care and recovery phase. Think cast changes or follow-ups. And finally, S is for sequela, signifying a late effect or a complication arising directly from a previous injury. And hey, a quick pro tip, do not confuse A for just being the first time seeing a specific doctor. It is strictly about the phase of active care. Section 4. Burns and drug rules. First things first, you need to distinguish thermal burns from corrosions, which are basically chemical burns. Burns are classified by depth. First degree is superficial, second is partial thickness, and third is full thickness. Now, the exam absolutely loves to test this specific rule. When multiple degrees of burns are present in the exact same anatomical site, you always code to the highest degree, period. Oh, and don't forget about category T31 to code the total body surface area using the rule of 9s. Okay, when you're coding drugs and chemicals, accurately categorizing the scenario is just make or break. A poisoning? That's an error, like the wrong substance, wrong dose, or even the wrong person. An adverse effect, on the other hand, means the medication was perfectly prescribed and correctly taken, but the poor patient just had a bad reaction. And remember, for adverse effects, you've got to code the manifestation first and then the T code. We also have underdosing, which is taking less than prescribed, and toxic effect, which involves non-medicinal exposures, things like solvents or venom.
Section 5. External causes of morbidity.
I actually like to call Chapter 20 the scene of the crime section. These external cause codes, they exist just to supplement your primary diagnosis by giving us the who, what, where, and why of an injury. They basically tell the payer exactly how the injury happened, whether the intent was accidental or intentional, where it went down, and what the patient was doing right when it happened.
But listen closely, because here is the absolute golden rule you have got to memorize. External cause codes are never reported as a principal or primary diagnosis. Never. They are supplemental. End of story. If you're looking at a multiple choice option on the exam and you see a V, W, X, or Y code listed first, yeah, you can instantly cross that one out.
Section 6. Summary and next steps.
Wow, we really covered an incredible amount of dense, rule-heavy material today, didn't we? So let's bring it all together. Feel free to snap a screenshot to save this summary. Just to recap, Chapter 16 is for newborns only. Chapter 18 demands you drop those integral symptoms. Chapter 19 requires strict seventh character placement, using that X placeholder for active versus recovery phases. And Chapter 20 codes, always supplemental.
All right, keep this incredible momentum going in your studies. Next time, in part 47 of this Explainer series, we're going to tackle the tricky Z codes, social determinants of health, status codes, and we'll even be revealing some official coding exam practice strategies. It's going to be a game changer. So until then, keep studying those guidelines and leave me with this final thought. Are you ready to stop thinking like a student and start thinking like an auditor? See you in the next one.